It is in the exam room that an animal must be closely handled and restrained while it is being poked and prodded by the doctor and staff. In addition to the preventive steps listed for animals in the reception area, follow these restraint guidelines in the exam room. When attempting to restrain a dog on the exam table, be sure you, the pet owner, and the doctor are protected from a possible bite attempt. This begins by minimizing the owner's role in restraining their own pet. This is especially important during potentially painful events, such as injections and the taking of a rectal temperature. Most owners believe their dog would never bite anyone, least of all them. They often feel the need to speak to their dog during these procedures by saying comforting words up close to the face of the dog. Instead, it is often best if the doctor politely asks the owner to allow their trained assistant to restrain the pet. A skilled restrainer always attempts to maintain control of the animal's head. This does not have to be forceful, but merely enough force as is necessary to control a possible bite attempt. Small dogs can be restrained as demonstrated here. Notice how the handler is using their hands and arms both to control the dog's movement. Medium and large dogs are best restrained using an arm wrapped around the head, as seen here. Notice how the restrainer is keeping their face away from the dog's mouth. The other arm is used to control the dog's body. The restrainer does not release their hold until communicating their intent to the doctor. When handling a dog that appears to be more likely to bite, take extra precautions to prevent injuries. Muzzling a dog is an excellent safety measure and is not at all painful to the dog. Assess the dog's disposition and don't take unnecessary chances. If you are not comfortable handling these potentially aggressive animals, seek assistance from another skilled handler. A thick towel or blanket is an excellent aid in handling these patients. A towel draped over the animal's head limits the dog's ability to see your movements, while simultaneously providing an excellent protective layer in case of a bite attempt. The head can safely be controlled through the towel while other procedures are occurring. When attempting to restrain cats in the exam room, you should also be concerned about preventing cat scratches. Most friendly cats can be restrained with minimal force by rubbing behind their ears, as demonstrated here. This controls the head while providing the cat with a favorable distraction. If needed, wrapping the cat snugly in a towel will limit the cat's ability to scratch. Cats that are excessively excited may require controlling them with a firm hold of their scruff. This hold produces excellent control with minimal pain. If the cat continues to resist, the back legs may need to be stretched with the other hand. This is called a stretch hold. Good restraining techniques, thoroughly assessing the animal's disposition, and a dose of common sense are all essential if injuries are to be prevented. In the event that someone does get bit or scratched, immediate first aid steps should be taken. A supervisor should be immediately notified so they can notify the medical authorities should this be necessary. With an injury that leads to bleeding, caution should be taken by those rendering first aid not to directly come in contact with the blood of the injured person. There are many diseases that can be easily spread between humans by means of blood contact. These blood-borne diseases can be easily prevented by the proper use of personal protective equipment, such as latex gloves. In order to prevent lifting injuries in the exam room, use a lift table whenever possible to lift or lower large dogs. When a lift table is not available, get help from another staff member when attempting to lift large dogs. Solutions to clean the exam table and solutions to treat animals are frequently found in exam rooms. Oftentimes, to maximize space, smaller secondary containers are used to store these fluids. When using secondary containers to store materials, the containers must be marked with its contents, lot number of the original container, expiration date if appropriate, and health warnings that are found on the original container. When filling secondary containers, use goggles or other appropriate face shields, aprons if indicated, and protective gloves. See the material safety data sheets on these solutions for information on the proper precautions you should follow when working with them.